Not an IQ test, it's a motor skill. And it gets a little difficult when you're working with tape, because when the tape kind of gets stuck to your gloves, it can make you get a little bit wonky about how to get rid of it. I'm just gonna show you what I do, and you're gonna get through it and you're gonna be fine. So I don't feel with these side rails that I need to put it down, but when you're going into a patient's room, right, these are no longer legal. A side rail has to be the full length of the bed. This would not be considered enough protection for the side rails to be up. But we're gonna get started. I need not these, I just wanted to show you these, but I'm really gonna work hard to try to find where these bio spheres are, right? So I'm gonna knock on the door, I'm gonna introduce myself, I'm gonna wash my hands and view the patient. Good morning, Mr. Smith. My name is Kathleen. I'm gonna be your nurse today. I'm here to change your central line dressing. It may be a little uncomfortable as I remove the old dressing, but I'm gonna try to minimize that to the best of my ability. Is it convenient for you if we do this now? Yes? Okay, thank you. I want to check your name and date of birth. John Smith, 1/1/1953. Okay, thank you, Mr. Smith. Again, you're going to meet the patient where they're at, right? They'll either give you a sign up or they're not going to be able to participate. I want to make sure that the head of the bed is elevated, and if I need to remove the pillow, I can. I don't feel right now I need to do that. Obviously, when we're working around the neck, that's a much more important thing to consider. I want to make sure, but assuming he's in an ICU environment, most ICUs now are individual rooms, but I would want to allow for privacy. Part of what I need to do is protect this area, not just from my germs, but potentially your germs as well. So during the procedure, I'm gonna put a mask over your face, and I'm gonna ask you to turn your face away from the site of the dressing. Just as a precaution, in case you cough, or while we're speaking, some saliva might come from your mouth, or if you needed to sneeze. I'm gonna take the old dressing off first, but I am going to mask you, and I'm gonna turn your head. We're just gonna state that. There's only one mask in the kit. You would state that you would put it on, right? So I would mask him, I would make sure that he's comfortable, and then I'm gonna turn his head away from the site. I'm gonna expose this area, right? And one of the things that's very important for me to do is to check if the patient has any allergies to chlorhexidine, because that's the cleaning agent that's used, and that's what this bio dot is impregnated with. So you can't use the bio dot or the chlorhexidine if they have that allergy. Unfortunately, patients may not know if they do or not. Chlorhexidine is a much more effective cleaning agent for skin organisms, but I would use the chlorhexidine. The patient may say, I don't know if I've ever used it, I'm not sure. You will know if a little later on in the day the patient has some reaction to it. The area will get reddened, they may complain of a little burning, itching. I would then go in and I would unfortunately redo the dressing again. You want to get that chemical off the skin surface. The last thing you want is some dynamic, like dermatitis reaction happening around that insertion site, right? So when I go in, I'm gonna know whether he's allergic or not. And for the demonstration, I'm gonna assume that he's not. So the first thing that I want to do is I want to put clean gloves on to protect myself, and I want to be very careful about not contaminating anything underneath the dressing as I take it off. Now what you're gonna see at the end of this is called a chevron. It's a little, like an upside down pink breast sign, right? The pink breast ribbon. We're gonna make this at the end, and what this does is it, as you're accessing these ports, gives you less torque on that catheter, right? This is sewn in. So these two small holes at the side, after the doctor inserts this, they take a silk suture and they sew this so that it is braced on the skin. Thank you very much, Jerry. Those are perfect. It is braced on the skin, but obviously if you're putting a lot of pressure on that, it's gonna hurt. It's like pulling up on a suture. So I want to take this chevron off first, because as you see me work with this a little bit, if I start to pull this dressing and I get to this point where the chevron is, it's gonna be a nightmare to try to sort this out and get it off the skin, right? So the first thing that I wanna do is I wanna take this chevron off. Okay, here we go with the first piece of sticky. Just put it on your glove, forget it. I've got my hands, it's not in my way. There's a lot of extra tape here. These have been on a while. Sometimes they're a little difficult to get off because they've literally been on since last semester. Now, somebody put a double chevron on this, probably practicing, which is fine, but it's obviously just gonna make it a little more difficult for me to get this off. Now, I haven't broken through the dressing yet, so I'm still okay as it relates to what's underneath here. Okay, but now this is very bad. And sometimes, you know, the best demonstrations are things that happen that's a problem. This is not an area that I should be touching. And if this actually happened to me, I think what I would do is get sterile gloves and I would put them on, right? That piece of chevron caused this dressing to kind of just fall apart. When I do get the chevron on, because I'd like to just show you, and again, I'm just sticking all of this on my glove. If that was still intact, what I want to try to do is pull towards me because of the sutures, right? If I pull away, it's gonna lift this up and it's gonna really hurt the patient. So I always want to start from this edge that's farthest away, right? So this is what we put our name, date, and initials on when we finish. Now, I would never really want to dig into the patient, and in real life, because people aren't plastic, this is a lot easier, right? But I've got this edge, and I don't want to let that flap back. Once I get an edge, I want to keep it in my hand the best that I can and prevent it from falling back down onto the wound, right? This is a real mess here. And I'm gonna use my index finger to add some pressure over the bio dot so that I really have to get some acetate, like nail polish remover, and clean this one up after I get this off. Right, so it would never really come off like that, and you're not supposed to touch anything that's underneath, right? So this really needs to be cleaned up here, but I've got it done, right? So what am I doing now? I'm just taking these gloves off with all the debris that's in it, and I'm tossing them. I want to open my kit, right? and I'm gonna open it and always put this flap under. Now I can touch what's inside there, even though that sounds crazy, because this is gonna open up onto itself, and what's inside is gonna be sterile, not what's outside, right? This is gonna rest on the top of the table. So at this point in the procedure, if I didn't have my mask on, I would put it on, and these are the sterile gloves that I could use. But again, do yourself a favor until you feel good about that, and take yourself some regular gloves. Now this blue wrapping has memory. So, you know when it always keeps folding back in on itself? If you give this a little tug, it takes the memory out. It'll lay flat. Now, each of these, right, has an edge that I can touch without contaminating the inside of the package. And every time I'm pulling an edge, I'm also giving it a little tug, right? So instead of having that flat back in, it's gonna stay. All right, so now I'm gonna open my gloves and I'm gonna put them on. And what I have in here is 1 chlorhexidine dressing, and I also have 1 alcohol dressing in case I need, right, the alcohol because he's allergic. Now, Jerry brought these in, so we're gonna use them. You wanna, before you get your sterile glove on, you wanna open this onto the sterile fields, right? And it's always the blue side up, printed side up. Again, these gloves, always the same, right? Hands up. You can help yourself by touching the inside of the glove, right? Don't mess with the back. Use your 4 fingers, that also helps. You can also open this so that you're not struggling, right? As long as you position your hand the right way, it'll get in there. So now I wanna make sure that I have what I need, right? So here's an alcohol swab. This is the chlorhexidine, right? This is the dressing that I'm gonna use. So one of the really important things, but it's helpful with the dressings that we use, is we wanna make sure there's no sign of infection, right? No pus, no redness, no swelling, no pain when I go to touch this. And I would always be aware of what his temperature was that morning, just in case when I got in the room, this kind of looks like it may be reacting in a way that I don't want. If he's also running a temperature, then he may need a battery of some blood work done to kind of see if he's got something cooking there. So again, these are sutured in. So I've determined that he's not allergic to the chlorhexidine, so this is filled. Or is it not? Let's see what happens. When you crack this, it allows the chlorhexidine that's in the bottom to rise to the top. I always want to think of a bullseye, right? I want to start in the center and work my way out. So I'm gonna start in the center. I can see the chlorhexidine coming down, right? I can't lift this up to go underneath it because it's sutured to the skin. So it's 1, 2, 3. And then I toss this, right? You let this air dry. Air drying potentiates the effectiveness of the chlorhexidine, right? You see anybody doing this, they're ignorant, okay? It may take a minute or 2 for it to dry. We can see very easy on the plastic skin of Mr. Sim, but it will dry relatively quickly on the patient as well, right? The next thing that I want to do is I want to get this biodot, and it's the sponge side down, written side up, right? And this is fenestrated as well, so you don't have to do anything. It just opens up, and we're going to put it around the insertion site, right? Now I have my dressing. I want to make sure that there's a little edge on this that you want to make sure you wind up getting so that you can pull this off the paper edge around it, because that's got to come off, right? So I want to go sticky side down, obviously, and I want to kind of center this, right? I don't want it too far down. I don't want it too far up. I want to just look at the center of this dressing, and I want to get it right there. And then as I begin to put the dressing down, I'm gonna follow the edge of the dressing with my finger. And I'm gonna take this off. Now he's got old dressing stuck underneath that, so that is not great. I'm actually gonna clean this all up while you guys are working. I wanna hang on to this, right? Because this is where I'm gonna put my initials, date, and time. Because every policy, or every hospital's policy is a little bit different, right? And I usually put this on the upper outer edge. Now, I wanna make my chevron, right? This is called a courtesy tape, right? Courtesy tab, so that you can get this off without it being stuck, right? So, shorter's better, and you'll see as you start to work with this, right? I want to take this, and I'm going to split it in half again. And I'm going to stick this one on my glove. I want to take this sticky side up, and I'm going to come to where the ports are, and I'm going to rest it underneath, and I'm going to make a right and a left. And then I'm going to take this piece, this is my last anchor, at the other edge, okay? So now I'm going to initial, date, and time it. Mr. Smith, you did a great job. I hope that wasn't too uncomfortable. I'm going to take your mask off now, and I can turn your face back around. The site looks very good to me. I don't see any signs of infection or anything at all that would alarm me. Is there anything else I can do for you before I leave the room? Thank you very much. Call bell's in place, and I go document. Right, and I'm going to document patient tolerated procedure well, no redness, no swelling, no drainage, no discomfort during the procedure, and that's it. So let me clean him up a little.